The preoperative and the postoperative care in a breast augmentation case of implants is absolutely essential. In this video, I am going to be talking about some of the pre and post-operative points which are very important to follow from the patient. Hello, I'm Dr. Arjun Handa, plastic surgeon at Handa Aesthetics and Plastics. A patient should be absolutely crystal clear about all the points and should follow all the instructions as directed by the plastic surgeon. Because the pre and post-operative protocol determines the incidence of complications and also the smoothness of the recovery period and longevity of the implants. In the preoperative period, the first thing that I ask my patient is to stop smoking and to abstain from alcohol for at least 2 weeks prior to the surgery. Smoking decreases the blood supply to the tissues and alcohol causes increased chances of hematoma, bleeding and delayed healing. All these things can hamper the recovery process and incidence of complications greatly. So, stopping smoking and abstaining from alcohol is an absolute requirement. If my patient comes to me and says that 2 days prior to the scheduling of the procedure, they had to drink or they had to smoke, I just postpone the procedure. I don't do it unless and until there has been a 2-week period. The second thing is that they should disclose all the herbal supplements and other medications that they are taking on a regular basis. Some herbal supplements and some medications can again interfere with clotting, healing and swelling in the post-operative period. Especially garlic, ginkgo biloba, ginseng and other such herbal supplements interfere with the clotting of the blood when taken in large amounts. Stopping these medications and herbal supplements for a week prior to the procedure is again a mandatory requirement. Finally, in the post-operative period, the smoking and abstinence from alcohol has to be continued for at least a month because it is this period which is absolutely essential to the recovery and to the decreasing of the swelling, and also if any secondary hemorrhage that can occur, it can occur during this period. Apart from that, my patients are required to wear a supportive garment for at least 3 weeks after breast augmentation. This supportive garment holds the implant in its position, decreases the interaction between the implant and the surrounding tissue and the injury that can occur with excessive friction. This also decreases the swelling, enhances post-operative recovery and just makes the patient feel more comfortable. In the post-operative period, a very common question that patients ask me is whether they can travel and when they can travel. So if you're traveling by road or train, then you can travel probably 5 to 6 days after surgery. And if you're planning to travel by a flight, usually my patients can go after a week, but I recommend that they wait at least 2 weeks just to be on the safer side. So some of patients who are flying from outside New Delhi and they are coming to me for the surgery, then I advise them to stay in the city for at least 5 days until the time that I remove the sutures and see whether everything has healed. After that, they are free to leave. In the post-operative period, there is another issue regarding the swelling. So after a breast implant is placed, there is usually some swelling in the upper part of the breast and also in the inner aspect of the breast. Some patients are unduly concerned about how they will appear after about 2 or 3 months because they ask me whether this swelling will persist because it looks weird as it bulges above the seams of their brassiere. So this swelling is very common in the post-operative period. In fact, it happens in almost all of my patients and it takes about a month to disappear. This is due to either the spasm of the muscle or some dissection that had occurred in the upper pole of the breast which causes the swelling over there. Finally, it's very important to note that the final result of a breast augmentation by implants is only seen after 3 months. What we see after a month after the swelling has gone is more or less the final result, but there is yet another phenomena which has to occur, which is dropping down of the implant. The implant that we put is usually initially in a higher position and gradually it descends to a lower position by the end of 3 months. So I advise my patients to come for a follow-up after 3 months after the dropping down has occurred and any minor asymmetry, if it was there initially, has disappeared. So if you are concerned that your breasts are looking a little weird, there is more swelling in one side and less swelling on the other side, or one is looking larger, other is looking smaller, or one implant is looking higher, the other one is looking lower, all these things are assessed at 3 months, and usually in most of the cases all of these issues are resolved by then. In fact, till now I have not done even one revision surgery in all of my breast augmentation cases. So if you have got a breast augmentation done and you are concerned about these issues, the advice is to wait for at least 3 months before you can plan a revision if it's necessary. Thank you for listening to my video. Please, if you have any questions, mention them in the comment section below. Like the video and subscribe to our channel.